our next slide?
Yes, next we want to talk about ways of encouraging generosity. So the good news here is that half of the respondents already had existing online giving platforms in place that they were using prior to COVID-19 impacting how we gather together. And so for those particular congregations, they just had to direct their givers to their existing online giving. 13% of the respondents said that they have since implemented online giving for the first time. So we're glad to see that they were able to take on those new platforms. And I think it's important to recognize, again, remember, we're talking 4 weeks ago for many of our respondents, which would have been only 2 weeks or so after the time that they would have stopped worshiping in person. So what that means is that they very quickly implemented online giving so that they could continue to offer opportunities for generosity. This is important. I use the phrase all the time that we have to be able to pivot as we juggle, that the things that we juggle continue to come, but being able to pivot quickly is an important skill that's necessary as we maintain how we move forward. So for those 13%, they did that. Then we've had another 13% that at that time did not have specific giving strategies, and then 10% who were using more traditional methods of mailing in, offering, or dropping it off at the church. As it relates to congregation growth, the area of most growth for congregations has been in innovation around technology, consistent with the things that we've said so far on this time together. That comes in using Zoom or social media or conference calls for small groups. And there's really plenty of opportunity to continue to increase it if we continue to focus on doing this well. As it relates to congregation survival, 3/4 of respondents are confident or very confident that their congregations will survive COVID-19. 20% are unsure. This again gives us an opportunity to think about what survival looks like and what sustainability looks like. And then I think in the same way that we heard from Dr. Burley earlier about what it means for us personally as we have this lens of hope. I think that's also true for our congregations of how are they breathing before and then how are they breathing now and the lens through which they look. When we talk about congregation attendance, 43% of the respondents expect their congregation to grow following COVID-19, and 31% expect attendance to remain the same. This causes us to think about, again, how that ethos of hope and faith might lead people to re-engage ministry that may have been de-churched before, that are unchurched before, that might want to engage differently at this time, particularly how we maintain the expanded digital connection, engage people that may have been become a part of our communities digitally that were not a part of our communities in person, and how we keep those relationships as we have the opportunity to transition back into our buildings.
Wow. These are very important pieces to pull out as we bring a bit of closure to this discussion. When we first talked about generosity, one of the things that I want to make clear that came out of this survey and other prior surveys about how people of African descent give, and people that are in poverty and other marginalized communities tend to give a higher percentage of their resources and income towards charitable organizations. So it's a misnomer that if any grant is given, any, type of stipend or, assistance occurs, it's not that we are on the receiving end, but we have disproportionately contributed towards the bigger pot, if you will, or benevolence or mission support, and however you may. So that's a very misnomer. I remember even having to change language of when we receive grants or receive assistance from the churchwide office and calling it welfare. And there's no welfare, it's about investment. in the communities that we're a part of. We're one church. When we look at the statistics that we tend to give more, and we are, and volunteer more in other particular areas, Pastor Amsalu, how can we have a more honest conversation about money and volunteerism and giving when so many of our people are in need? Although the scripture teaches us you have not because you ask not, how can we have a deeper conversation about how we give and our participation in generosity?
I think when we think about generosity, we think about having and giving out of the more we have. It's not about giving from what we have, but it is an act of faith, an act of. So one person once said, "Don't hinder somebody's generosity and accept what." And sometimes as a church, we do hinder also. I am afraid that we hinder the generosity of our congregation. What I mean by that is that we have to be honest and tell them the reality, but also care for them. Appropriately. Think the widow and Elijah, and that is the powerful thing. At the same time, so giving is the sign of spiritual health. We care for our congregations, but we show them, we tell them the stories of their giving. This is what tell the stories of the generosity, the act of generosity. It's not the lack of it, the act of it, what we accomplish by the generous support of the members that what we do. The other thing that I wanted to say about generosity or giving is that some of our congregation may not have the platform for giving. As a ELCA, we kind of partnered with Tisely, and they are providing and helping, assisting, even the platform, providing the platform for our congregations to do that. So I think communicating that to our congregation is important. In some cases, especially in the synod I serve, for those who don't have the platform and cannot put up the platform right away, we provided on our synod's website that people could give that. So the money goes to the particular church, but we provided the possibility of doing that. So that is also possible. Congregations also partnered to do that. In some congregations said, "Oh, hey, we have the platform and we can help others to do that." Along that line, the PowerPoint you shared, Pastor Cheney, about our congregation's confidence of survival. Some said, "Okay, we will be surviving." Others say they were not confident. Maybe this is the time that we also have to discuss what survival means. What I mean by that is maybe survival means partner with our neighboring congregation. We don't have to do by ourselves. Maybe survival means merging with our neighborhood congregation or the nearest congregation, ecumenical partners, whatever. So survival means maybe it is holy closure. We have to close and move on and use that resource for rebirthing of another minister. So we have to probably address those issues going forward. And all of those is faithful discussions. It's not about lack of faith, or it's not about days. It is about faithful discussion of doing ministry together.
I think that what you're talking about is very important. And as a part of that, I said when the social distancing or spatial distancing had first come about, and it talked about church closures, and I'm very happy that most of our leaders and bishops have encouraged special and social distancing, particularly for our congregations. But I said at first it wouldn't affect many of our congregations because less than 25 people worship in many of them anyway, right? Like as a whole, and that's across the board, not just congregations of African descent. So Pastor Cheney, what needs to happen next in strategic evangelism? Like, so let's say we don't get to go back to church for another 6 months or a year, right? What does invitation look like in right now and afterwards? So how can we prepare for strategic evangelism? What do we need to do?
So I think one of the first things we need to do is to remember that and I think this is true of evangelism all the time, but particularly now, is that it has to be rooted in relationship and care. It has to be rooted in love for the people. And I say that because our communities are reeling. There are people who are sick. There are people who have lost their loved ones. There are people who have lost their jobs. With no hope of when that might come back, they cannot easily go and find another job. There are so many different implications, people struggling to pay their rent and so on, and the lines for food services are wrapped around parking lots and buildings and so on. And when I think about evangelism is not going to look like you printing out a glossy flyer and handing them a flyer to invite them just to your regular Tuesday night or Sunday night or whatever. Right. First of all, they don't want to touch it. Let's start there. But also, when people are reeling, the very thing that they're thinking about is not about coming to do a thing that they've not been doing before, and that is not rooted in care for and in consideration of the very things that are most central to them right now. And so I think I've always talked about having multiple front doors to the church. We often think of the front door of the church as people coming into your building on Sunday morning at 10 o'clock or 11 o'clock or 9 o'clock or whenever you have worship. But my experience in ministry has been that there are often many entry points to ministry that comes. And now that front door may be a completely different entree into ministry for people that is rooted in caring for them where they are right now, and being able to, when we talk about messages of faith and hope, of living that with people on the ground in the midst of the things that they are going to. So that would be the first thing that I would lift up. And the second is that we cannot forsake that online audience just because we can get back into our buildings again. That would be the worst lesson for the church as a whole. And I speak not just of the Lutheran church, but for the church as a whole, that there's been so much engagement that has happened through remote means that on the days when the doors can open again to our buildings, we can't close our laptops and tablets and phones and disconnect, stop paying the $11.99 or whatever you pay for your Zoom account or whatever the case may be, and go back to business as usual. That would be the worst thing we can do. We have to continue to be able to engage people through these new innovative ways of doing ministry. We have spent plenty of time trying to figure out how to do ministry differently over the last 4 to 6 weeks, and we have to keep that as a part of our model of ministry. To reach out. I was talking with someone, a pastor who is now engaged in rural, in radio ministry because they live in a rural area, and so Wi-Fi signals are not strong, and so the particular area way that they engage in ministry is through a joint radio program with another congregation in their area, and in thinking about what that might look like when we are able to go back into the building, but maybe that becomes a front door of ministry, particularly for a person who might be a little bit uncomfortable walking into the doors of the church. Perhaps these kinds of mediums that we're using become a way to make people more comfortable, that maybe that leads them to join us in person, and maybe they never join us in person. But if our goal is to be able to share messages of hope and faith, as we said in one of our very first slides that we talked about today, then we need to keep up what we're doing as a part of how we share the gospel.
That's going to be so important. I say also two things. The first is, according to what you're saying, is to have ready an updated website. Like our websites are so hadn't been changed in months and years. And like, if there's nothing, like I'm learning how to master Zoom right now, like reading and to do webinars and making sure that I have it, down packed. Like many of our church leaders, if you've got to find ways to either find lay people or somebody to help with these church websites, because I Google everything. If I want to know something, I literally Google it. And again, I remember years ago, almost 15 years ago, that's how Pastor Cheney found the church I served in Atlanta, because we had an updated website that was able, and thank God, and now she's a pastor in the church, the ELCA. So we're grateful for that. So making sure that your websites are fresh and appealing and updated, so that people know. You shouldn't still have on your website that you're having service at 11 a.m. on Sunday morning and a 9 a.m. in a Bible study, at your location. It needs to be pointing people and driving people right now to your digital platforms and those capacities. The second thing I think that we've got to, I always believe in looking at what other people are doing, right? Because there's nothing new under the sun. And I'm watching the Jehovah's Witnesses and the Church of the Latter-day Saints, and I want to know what they're doing, because they have an evangelism strategy that compares to none. I mean, they are out there, right? And I want to watch how they are shifting. I don't believe what they believe, but I believe in what they're doing, their practice, their method. And I want to see how they plan to shift in this current time, in this digital age. I'm here in New York. They're at every station, every subway station that you can have, sitting outside all day long with their tracts. And again, as we talked a few minutes ago, people don't want to touch a piece of paper no more. So what will their practices be, and how they're shifting? Again, they do evangelism well. I just want to find out how they engage their methods. Dr. Burley.
Can I say one thing about websites real quick? One thing about websites, we talked earlier when we talked about staffing, that for many of our congregations, they don't have significant staff. We've also talked about engaging lay people and so on. But even if you don't have the resources to be able, then I'm thinking people resources to fully engage and regularly update your website, have a good static page up. That if you have one static page that has the most recent information, we don't necessarily need all the bells and whistles and all of that. Just have good content that is there and that remains relevant, because that's what people are looking for. The same is true for your social media as well, that for many congregations, their Facebook page is the first place that people engage them, and now Instagram and others. Make sure that we're keeping those fresh, because that's where people are learning more about ministry.
COVID-19, we talked about it disproportionately affecting people of color, or Black people in particular, really. And even the Latinx numbers includes people of African descent in the Latinx community. So even though their numbers seem to be big, and this is not to minimize anything, we have to realize the ethnic context here that is a construct within that number. So the numbers may be mixed up a little bit. But Dr. Burley, the thing that concerns me the most and that we need to pay attention to is growing younger. So as COVID-19 is disproportionately affecting people of African descent and people who are over the age of 65, right? Particularly because of aging conditions. So there'll be more deaths of older persons and things like that. And some of that's natural. Some people we hate to see any loved one go. But how are we going to focus as a church on growing younger? How are we missing the mark right now with younger populations? And can that be corrected?
Sure. Well, I think it harkens back to my earlier comments about this box that faith has traditionally existed in. and the need for destroying the box, essentially, and doing faith outside of the box. And so that means not only being a church that accepts all, but a church that affirms all. Those two things are different, right? It means being a church whose doors are genuinely open for whoever presents themselves. It means being a church that is amenable to singles ministries and to direct leadership and involvement from same gender loving persons, and churches that embrace and affirm ministry outside of our tabernacles. And so, some of the most thriving churches where young people attend is at a bar in Harlem. I know colleagues, young pastors who have, wine and scripture or something along those lines at a pub, and young people are showing up in droves to hear God's word in a way in which identifies with their social context.
I would be there right now. It's Sunday afternoon.
Right. And so, again, I think COVID-19 has given us a moment to be agile, to be nimble, to be flexible in the ways in which God is calling us to do ministry. I hope that we don't leave that agility with this moment. I hope that this moment creates a movement of a new church realized, one that, people come to Christ in ways in which, otherwise haven't been traditional. We've been having church over the phone because I'm a part of a membership where people are too old to engage Zoom or, Facebook or Instagram Live. And so we have to do worship over the phone, and we preach over the phone, and we pray over the phone. We even have someone sing over the phone. And I've been encouraged because you realize that God is present.
Yes.
And that it was never about the building, that it was never about, the cross, that it was never about even the physical table, that God is present wherever we are, but even where we are not. And I think that's been encouraging for us to be able to have a full worship experience, even with the sacraments. We had Holy Communion over the phone, where we just told people to, whatever cracker or wafer or bread you have, and whatever fruit of the vine that you have present in your house right now, let's get that and let's commune with God. And God was no less present in that moment.
Uh-oh, that's a controversial thing in many of our chat sessions in the
I'm
ELC.
sure. I'm one of those moments where I'm glad that I am not of the caller, so that I don't have to engage in those particular chats. We just do it, and we give God thanks for God's blessing and God's presence, even as we convene over teleconference lines. But needless to say, young people are people of faith. Young people are people who believe in a higher being, regardless of what we call him or her, and regardless of where we seek out that higher power, whether it's a church or a bar or someone's home, living room. And I think that we have to embrace that flexibility so that young people will continue the church. It just may look different from the church of old. And so this is the proposition that I, bring our members all of the time who are aging, as we have embraced and entered into conversations about ministry sharing and new ways of not only surviving, but thriving. And I say, if you love this church and this is a church that you want to see be viable in the next 20 years, then will you be willing to reimagine the ways in which we do church so that that might happen. To let go of old constructs, to let go of old boxes, to let go of kind of traditionalism, and to walk into a new model of evangelism, a new era of ways in which we engage Christ, knowing that God is with us, and that it was the same God that was with us a century ago or 2,000 years ago. And in knowing that, then, ministry is being fulfilled. So it's really about agility, flexibility, that we're all faced with right now, and holding on to that even as we are allowed to maintain and return to our buildings. And so, as Reverend Chaney mentioned, continue those virtual worship services, or making worship accessible virtually. Continue those phone calls. Maybe every fifth Sunday of the year, of the month. Those months that have 5 Sundays, maybe that fifth Sunday will be the day that we don't come to our building. Maybe it's the day that we go out and we stand on church corners, or we go and gather somewhere else where young people are, if they're not necessarily coming to where we are. And so really just, being
like at a bar,
and just being open to the possibilities, knowing that God is with us, even when we don't recognize him or her. He continues to reveal himself and walk alongside of us over the phone, over Facebook Live, and even in our buildings.
I think that's very important. The message you're talking about with younger people, I think that's a strategy. That's a strategic model that we should be engaging, that God is with us. And that's so important about what are we saying. We preach Jesus and Jesus crucified and resurrected, but I think the message of hope, right, is that God is with us, right? Right now in this pandemic, we're dealing with, these younger populations have dealt with so much trauma politically, emotionally, mentally, so that there's a need to really share in our growing younger engagement and strategy, to share that God is with us. And I was always told that if God is with you and for you, who can be against you? So that's a reality. I want to share these last 2 slides, and we're almost out of time, but it's very important. I was encouraged by these last 2 slides that talked about people of African descent in the Lutheran tradition and their sources of support, and about our organization. Pastor Chaney?
So again, we asked where our participants were finding support for themselves and their congregations, and what we got was a multidimensional response. We received responses both of church-centric sources, our synod offices and bishops ranked as the highest source of support, and community-centric sources of support, our state and local government leaders and news and media outlets. I think as we talk about this, though, it is important that we think about how and where we receive our information, and use discernment to ensure that we are using trusted sources as we engage. And then we asked about our primary chapter ADLA priority for their ADLA chapter. We know that ADLA has 6 priorities, and the respondents found that strengthening leadership and congregations was the most responded, that was the priority for their chapter. And of course, that is going to be particularly helpful in this season as we think about how we strengthen our leaders and our congregations going forward.
This is very important, and the reality is that as people of African descent in the Evangelical Lutheran Church in America, we are truly connected. We are not aloof. We're not a people who don't know what's going on. We're connected to our synods. We disproportionately probably have to fill in, some call it tokenism, but we talk about active engagement and investment and participation on various Senate committees and national committees. So we're truly connected to our synods, our bishops, our church-wide expressions, and particularly our local municipalities and knowing exactly what's going on. Many of our leaders are first responder chaplains and other organizational leaders, and obviously, again, healthcare workers and things like that. One of the things that I want to lift up too is that sharing the fact of our economic access. The ELCA Federal Credit Union has been approved as a site and an opportunity for us to apply for PPP loans and getting those fast tracked. And I'm finding, and I'm looking online, and I see many individuals participating in that and having good access. And I love that. And some of our leaders, Eva Roby and others who are serving in our church-wide expression, have quickly responded in a way. And we need to find ways to connect our churches of African descent to gain access so that we can move away from some of those decreasing numbers of staffing. And actually, the reality is we may need to find ways to increase in this next entity or iteration of what the church will be. Also, lifting up, finding better ways to engage and reimagine our purpose and our connection with Lutheran disaster response and other entities like that, that can also help us in this pandemic as well. So we are truly connected, and I'm grateful for that. And many of you know, you can look at our ADLA website, which is www.adlaelca.org, adlaelca.org, where you can find our priorities as an organization. And we're working very hard at expanding and engaging. And historically, we've been engaged and dealing with social determinants that have disproportionately affected people of African descent's health. We've worked strongly with the HIV/AIDS community leadership globally, internationally. So that's something that we want to keep going and engaging. We want to be on the front line, if you will, of advocacy for resources about understanding this pandemic, regarding race numbers regarding reporting on how this is affecting people of African descent. We want to do that, and we're participating with the ELCA Advocacy Office with that as well. We talked a little bit about some steps to take to re-engage us for our future, right? And one of those steps, Pastor Amsalu, you talked about, is creating lay education centers. So we want to protect things like LTCA, the Lutheran Theological Center in Atlanta, that has a good way and opportunity for us to host anti-racism training, to do immersions so that people understand urban immersions or taking the plunges there so that people know how to do ministry in various contexts. And also lay school training, which is also, you know, I love that our Latinx community has multilingual schools and things like that they've engaged. And this is our epicenter, if you will, and we've got to find a way to better utilize that. We have sub-centers at our theological school in Chicago and our theological school in Philadelphia, like the Urban Leaders Institute. But I'm talking about institutions organized particularly for lay people and in a different context that can serve as a national center, if you will, for Black Lutheran education. The next thing that I also think that we need to look at is getting coaches for all of our pastors of color, and particularly people of African descent. And making sure that in this time more than ever, I believe every pastor, again, like I said before, needs a coach. But I think in this particular time, with the different levels of things that pastors of color and African descent have to deal with, issues that are systemic issues, right? This is not just crisis issues, right? Crisis is a moment, right? But these are systemic issues. We're going to need coaches to help guide us through this and pull us through in a healthy way. And the last thing that I think that we need to continue, and people talked about ADLA as a various chapters engaging in very clearly, is the upcoming election and every election, right? We don't want to get so focused, and we do have to focus on this pandemic, that we also don't realize that there is an election that is occurring that will deal with many of the things that we're faced with now. The systemic change that's needed can be shifted by electing the right leaders, right? So when Luther talked about how to deal in a pandemic, he basically said of mayors and other municipality leaders that they need to stay in place because that's what they're called to do in their job. And we're seeing, you know, everybody loves my governor right now, Governor Cuomo, and all of his stuff that he's doing. And, you know, they tell me that your president of the yet to be United States, they had to stop his press conferences. But, you know, neither here nor there. The reality is that we've got to stay engaged in the political process, because if we don't, then these things that we're dealing with systemically will continue to exacerbate themselves, and we'll grow in a deeper hole. And we want to come out upgraded and come out victorious and as we continue to live our best lives. So in conclusion, I want to ask everybody, what's happening in our world that we should be focusing on or advocating and sharing and proclaiming? What is the thing right now that you think that we need to most think about in our world that we should be advocating, sharing, and proclaiming?
It's not about sharing the proclaiming, but I just wanted to lift up as kind of a summary, things that we said. One thing we have to kind of do is using the resources that are available to us. I mean, for free. I mean, if you have internet, computer devices, and lighting, you can live stream. And there are some, we don't have to pay for YouTube, but there are YouTube channels and Facebook lives and Instagram lives and Zoom. Let's use the available resources that is there for us, and don't be afraid. Maybe ask our youth, as Dr. Burley said, and be led by them to use that. Let them lead. The other kind of known fact I just wanted to repeat is that when we are doing virtual services or Bible study, we assume that everybody who are listening to us know where we are located and who we are and what we are up to. Don't forget to introduce yourself, your ministries, and invite them to be part of, but also follow up with them. If somebody joined and kind of interacted, please just follow and do some evangelistic follow-up. So I just wanted to lift up those.
That's important. So what else should we be focusing on? Okay.
I would lift up relationship and advocacy as two things. Relationship with Christ and with each other, in that the way through this is not individualistic. That we survived this virus as community. So I've seen the meme go around that says the biggest problem here is that it's like that group project where one person didn't do their work and everybody else is suffering and we all got to stay in the house as a result, right? That the way through this is communal. It's the way we get through this season of dealing with the height of the virus, but it's also the way that we recover. That when we're able to leave the house again, we've got to help one another. And that's a focus for us as people, and it's, I believe, an important focus for our congregation. And alongside that is advocacy. Advocacy for testing, particularly in our communities that might be more underserved and less represented. As we get into talking about contact tracing, as we get into talking about provisions for people being able to, once the contact tracing happens, to be able to quarantine. I'm blessed to be able to be in this house by myself, right? But that's not the story for so many people that live in other places that will need support for how we don't just continue to spread. And as those kinds of resources are happening in our communities, that we have to be on the forefront of advocacy to make sure that as resources are happening, that they are happening in underserved parts of our communities as well. And I will also say, please take your census while you're at home. There are resources tied to that as well that's going to to be imprudent as we look to the future.
Dr. Burley, what should we be advocating for? And also, who should we be listening to? Everybody's on Dr. Fauci and things like that. And so are there any people of African descent who know our story that we should be listening to in particular, besides yourself?
Sure. So there are a number of people who are on the front lines, people of African descent, who are providing care, but who are also learning new things each day as this virus changes daily, and then sharing that information with us. The National Minority Quality Forum, which is a nonprofit committed to health equity in people of color based out of DC, is doing tremendous work around engaging the Congressional Black Caucus around the deficiencies in testing and treatment and contact tracing, as Reverend Cheney mentioned. Johns Hopkins University has been the most thorough resource, its Coronavirus Resource Center for me, and all information is being provided for free. They keep a running total of cases, and they've even began to make available racial and ethnic demographic data as it relates to COVID-19, as it is being shared by state and local health professionals. You know, Dr. Fauci, Dr. Birx are credible individuals, people who I've worked personally with on the HIV and AIDS epidemic. They are under the thumb of a non-credible administration. And unfortunately, the longer you work for the circus, the more likely it is that you become a clown. And we've seen that these credible people have sometimes been sucked into this cycle of misinformation that comes from our White House, which is unfortunate, but I still want to say that they are the leading experts on this pandemic in the United States context. The information from the CDC is still reliable. But again, Johns Hopkins is where I've got my information from. But there's also this idea of nothing about us without us, and the only people who can save us is us. And so please be clear that there are people of African descent working tirelessly around the country to deal with this problem. We know that scientists at Meharry College of Medicine are currently working not only on a vaccine, but on a treatment, because they understand the what's at stake here. And so I also want to encourage everyone to take your healing into your own hands. Many of us are in states that have began to reopen. Please know that these reopenings are premature, and that just because they say that you can go outside doesn't mean that you should go outside. And so continue to exercise good self-judgment, continue to access good information that is credible, and continue to decide for yourself what's best for you and your family in times when our elected officials aren't always acting in our best interest. And know that this too shall pass, but we will have to emerge from this as new people, and new people who exist in a new normal. Things will never be the same. And so again, harkens back to this idea of flexibility. You know, the passing of peace might have to change in the future. The ways in which we engage in the tactile expressions of mutuality, a smile, you know, might become a thing of the past, as many of us have to wear masks now. You know, these are not necessarily assaults on our freedom, but they are what's necessary to make sure that we can continue to exist, you know, not only as people, but as a fellowship. And so know that these moments are only minor setbacks, and that we have a major comeback in store for us. And I'm confident that we will emerge better than how we went in.
Well, I just want to take this time to say thank you to each and every one of you, Pastor Amsalu, Dr. Ulysses, and Pastor Cheney. I just want to thank you for your time today. And in the near future, I want to bring you back on individually, and maybe we'll do an Instagram live where we'll have a real-time opportunity to engage the world community, the Lutheran community in particular, with more information. This particular survey, Checking on the Community, is brought to you by the African Descent Lutheran Association. And again, I'm Pastor Lamont Anthony Wells, the National President of the African Descent Lutheran Association. And you are welcome to receive a copy of this particular survey and the results on our website at www.adlaelca.org. That's adlaelca.org. And we welcome you there to also support us. There is a donation opportunity for you to support this robust organization that is doing great and mighty things to support leaders, to support congregations, and to support the people and the communities around us. With our various objectives. And God is really blessing us and taking us to new heights unknown in the past few years. So to be a member, and you don't have to be a person of African descent to support us. So your financial donations are very important to keep the ministry of this particular association within the ELCA as the voice of people of African descent alive. And also, I would like to give you a open welcome to our biennial assembly, which will be held in Atlanta, Georgia in the summer of 2021, pending that this pandemic ceases or comes down. So you'll find out more information about that again by visiting us at www.adlaelca.org. Again, thank each and every one of our panelists, and you will hear from each and every one of us soon. God bless you. Good night.